Yeah, welcome back to Midday. Dr. Brett Luddington is joining me now from Intermountain Stem Cells. They are located right in that Fort Union area. I've been to your office and it's gorgeous. We're talking about pain today, and so many of our viewers out there, so many people suffering from pain. What can you do for them with stem cell treatment?
We do a lot of orthopedic stem cell work. We also do stem cell for hair therapy, some skin issues, but we do a lot with orthopedics. So any kind of joint issue, really, we're there for you.
So you're saying knees?
Knees are big issue.
Backs?
Big problem, yeah. Necks,
okay.
Elbows, shoulders, all those respond really well to stem cell regenerative medicine.
So Dr. Luddington, though, how do you know if it's right for you?
You really need to get a good orthopedic exam. That's key. Stem cell therapy is becoming more prevalent than ever. There's a lot of seminars to learn about the science behind it, but it all comes down to, will stem cell regenerative medicine work for you? And so then we need to have an orthopedic exam. So what we do is we do a consultation, the examination, and then we really stress we want or demand we get an MRI. We want to see that soft tissue. We want to have analysis completely of what is going on the joint, what needs to be and what can be regenerated. And sometimes people are not a candidate for stem cell therapy, and they need to be told that.
Because you want to make sure each patient has those optimal results.
Absolutely,
that they're looking for.
Yeah, we want success, and for regenerative, to grow things back, stem cell therapy does that. If there's something in the joint we need to get out, stem cell therapy is not the option for that. We need to get something out. But
how many treatments until you see results, and does it depend on the location?
As far as the treatment goes, there's one injection that's done in and out in about 45 minutes, and then that starts the process, and you'll have full outcome within about a year. But people start to feel pain relief sometimes that day, usually within a couple of weeks, and then it just gets better from there.
You're feeling better and better throughout that process. I know when I came in, we were talking about my husband and how his knee hurts when he runs, and I said, is he a candidate? And you said, I can't tell you. We don't know.
Yeah, for sure. But most likely people are, because most issues are osteoarthritic conditions, which is a degrading, wearing down of the cartilage. People get told they're bone on bone all the time. There's still some cartilage there, and regenerating that cartilage is the goal, and that's where an MRI comes in to let us see how, well, first of all, the exam qualifies the patient, and then the MRI quantifies how much tissue needs to be regenerated, and is it something that's possible.
As a doctor, are you amazed at the results you are seeing?
Oh, absolutely. This was not an option when I was done with school, to actually make a joint better next year than it is now. It's phenomenal. It's the answer for osteoarthritis.
Before you just repaired it, correct?
You dealt with the pain, you did anti-inflammatory side. I know this is miserable, we can't fix it, but here's some pain relief. Now we can say, actually, we can make that joint better, and so it won't hurt you anymore, so you don't have to have the anti-inflammatory or painkillers.
Let's talk about
fantastic.
Intermountain Stem Cells and what you're doing right now for our viewers.
Well, as I said, we have always want to have people come in for a consultation to understand the stem cell therapy science, and then at the same time we'll turn it into an orthopedic examination to personalize it, to say, I know you understand a little bit about the science now, does it work for your condition? And then we really like to have MRIs. We'll insist on that, and either people will have an MRI before, if they already have one, or we will provide one for them. So there's a free MRI, so the free consultation, free MRI, free examination to find out about the stem cell therapy and if it'll work for you.
Yeah, call right now. That phone number is on the bottom of your screen. We can also put it on our website, Intermountain Stem Cells. They are located in that Fort Union area. They're so great about answering your questions when you go in. If this is something you've considered but want to know more about it, that is the place to go. Dr. Luddington, thank you so much.
Thank you,
for
Nisha.
stopping by. It's such a beautiful day. We have more of your weather forecast when we come back on Midday.